Hi, it's Dr. Fox, licensed psychologist in the state of Texas, and in this video we're going to talk about defeating depression in teens and adults. And depression is a very serious condition and one that can be very insidious, so knowing about it, recognizing it, and knowing how to manage it and seek help is so important. Now, depression is a common illness worldwide with more than 264 million people affected. Now, although there are known effective treatments for mental disorders, between 76% and 85% of people in low and middle income countries receive no treatment for their disorder, for their depressive disorder. So what we're going to do in this video is we're going to pull back the curtain on depression and start defeating it. And what we want to do is first we're going to explore some of the information, some of the data, give you some groundwork, some information that you can extrapolate from it, learn about it to give you a context. Then I'm going to give you some tips in how to deal with it and how you can implement these adaptive strategies to help defeat your depression. So please like, share, and subscribe. And I have another channel also on YouTube, so please check it out. That would be great. And let's get started. Defeating depression. So depression is obviously a serious condition, as I mentioned. Now, I'm going to report U.S. data, but this can be generalized to other parts of the world as well. An estimated 3.2 million adolescents aged 12 to 17 in the United States had at least one major depressive episode. Now, this number is representative of 13.3% of the U.S. population, right? That is between the ages of 12 and 17. That is so huge. And the prevalence of major depressive episode was higher among adolescent females, about 20%, compared to males, 6.8%. I mean, just listen to that disparity. So it is so high in females, but yet much lower, and we don't want to say that it's not important, but much lower in males. An estimated 17.3 million adults in the United States had at least one major depressive episode. This number represented 7.1% of all U.S. adults, and the prevalence of major depressive episodes was higher among adult females, 8.7%, compared to males, 5.3%. Now remember, right, we just talked about that difference between adolescent girls, about 20%, right, and those adolescent males, 6.8%, and adults, right, we have 8.7%, but there's less of that disparity, 5.3%. This is really scary data, particularly if you have a daughter, particularly if you're a teenager, right, between 12 and 17, you know, that this depression is so prevalent. It's so important to be aware of these numbers and how serious of an issue this is. Now, in 2017, an estimated 11 million U.S. adults age 18 and older had at least one major depressive episode with severe impairment, 4.5% of all U.S. adults. That is so many. And when we talk about severe impairment, we're talking about that this impairment impairs their ability to socialize, to earn an income, to go to work, to take care of their kids, to take care of themselves. That's what that serious impairment means. So it causes what's called socioeconomic dysfunction. And that's so important to be aware of, that critical component does your depression cause that socioeconomic dysfunction. Now, there's different types of depression. We're not going to get into all the different types here. If you'd like me to do a video on different types, I certainly can. Just leave that in the comments. But it's important to know that depression, right, that socioeconomic dysfunction is so severe that is one of those factors that's across all disorders, that socioeconomic dysfunction needs to be present. Now, an estimated 19.6% received care by a healthcare professional alone, and another 17.9% received combined care by a health professional and medication treatment. Treatment with medication alone was least common. That's about 2.4%. Approximately 60.1% of adolescents with major depressive episodes did not receive treatment. Whoa, you should be like, really? 60.1% of adolescents with major depressive episodes did not receive treatment. I'm saying it again to emphasize it. And an estimated 65% received combined care by a health professional and medication treatment. Now, treatment with medication alone was least common, right? That's about 6%, and approximately 35% of adults with major depressive episode did not receive treatment. That is huge. These numbers are so large, and there are folks who don't have access to mental health care. There are folks who don't know when to access mental health care, or in some cases that what they even need to do about it. What are some of those criteria? What are some of those issues? What are those concerns? And as part of what we're doing here, these statistics are certainly scary and they can feel overwhelming, right? Know that depression is treatable and it can be managed, but it has to be dealt with head on. So if you see signs of depression, right, you want to talk to your kids, partners, parents, and others about it. Don't worry about offending them if you think you see it in your kid or if you think you see it in your spouse or someone else. Don't worry about offending them. Extending that hand is so important. Now, we're going to talk about some of the signs of depression. Hopeless outlook, loss of interest in things you once enjoyed, like hobbies, increased fatigue, sleep problems. Yes, these are not mutually exclusive, but related. Also, anxiety such as nervousness, panic, worry, fear. These are all factors as well. And it's important to realize that anxiety and depression are actually related. And the way they're related is that anxiety, right? You can be really anxious for a while, you're nervous, maybe some panic, maybe worry and fear, and you worry and fear, and you worry and fear. What happens is your energy starts to dissipate. Once it gets so low, then you can slide into a major depressive episode or just a depressive episode. Depends on how bad it is. Remember, we talked about that socioeconomic dysfunction, right? So we don't need to look for that. But you can have both. You can have major depressive disorder with what's called anxious distress. And so sometimes it can be like an agitated depression. So you have this depression, but you're really frustrated and restless and very easily provoked or annoyed, things like that. But then that goes against sometimes the way we typically conceptualize depression, which is seeing it as though, it is this very sullen, sad, down, not eating, which of course is another factor, this fatigue and sleep problems, things we just talked about. And other depressive factors that you need to be on the lookout for is irritability, changes in appetite and weight, emotional instability, right? So that irritability as well, and talking about or considering death. These are things that we have to be aware of. And if you see that someone is posting things like that, or if you see that people are talking about very dismal, dark issues and concerns, ask them how they're doing. Ask them if they feel depressed. And, you can always find, there's a link here in the comment section that can be a good resource for you worldwide. So, there are things that you can do. And now I'm going to give you some strategies and some tips on how you can defeat depression. First and foremost, you're not going to like this. So here it comes. But you want to cut down on the phone time. And I know you hate to hear that, but it's true, right? Consume funny and lighthearted material online. Try to stay away from a lot of that dark, dismal stuff. Try to, be resistant to watching too much of the news, things like that. Don't get absorbed into very dark and negative content, right? And what you watch, remember, that goes into your brain. So as it goes into your brain, if it's very negative, right, and that's all you're consuming, it's hard to see the positive. And it's those things, if that depression is kind of swimming in there, that it can grab onto it and it can accentuate that outlook. If you watch the news, it's a lot of trauma, it's a lot of disaster, it's a lot of loss, it can be a lot of death and things like that. And it's important to realize that if you have a tendency for depression, that depression is going to certainly impact how you see the world and impact how you see yourself. And if you're consuming negative and dark material and that you have that major depressive tendency, that both of those together, it's like just gas on the flame. It's just going to kick it up even more. So again, cut down on the phone time, try to watch some lighthearted, some funny stuff, things like that. I'm not telling you not to watch the news, right? But watch it for 30 minutes. I mean, after a while, they start repeating the same stuff anyway, just kind of all day over and over and over again. So another tip or strategy is find workable goals that give you a sense of accomplishment. Most people feel guilty when talking about goals because they set unreasonable or unworkable goals. Now, a goal is workable if it's controllable. So it doesn't depend on other people. It's something that you can control and manage. Is it manageable, right? It's not overwhelming. It's not too much. There aren't too many working parts that you can't get a hold of. Is it realistic? So is something that you're able to do, right? Is it not for someone else, right? It's not dependent on someone else. This is something that you're able to do, and it's something realistically that you can do. And I'm not saying narrow your view, narrow your belief in yourself. I'm saying that you want to say, is that something you believe that you can do? Your sense of efficacy, your sense of ability, right? And also, is it measurable? So whether or not things are getting done, whether you're achieving that goal. So many goals sometimes, I think we have this very ill-defined or nebulous view of goals. Well, I want to do A, but A doesn't get well defined. So what we want to do is you want to try to operationally define your goals as much as you can, those different components. And remember, as you're striving for your goal, if something goes wrong with your goal, adopt what can I learn from this attitude versus that judgmental, right? This is why I'm horrible kind of attitude. Don't internalize that. Resist that urge to do that. That's your depression talking. Your depression wants you to internalize failure or you internalize struggles, that it's your fault. And remember, it wants to increase that sense of hopelessness, helplessness, worthlessness. But resist that. I mean, everybody stumbles, right? The most successful people in the world have failed more than anybody else. And that is totally true. Totally, absolutely true. You want to be careful comparing your progress with others. Don't look externally. Your progress is your progress. Maybe your neighbor does something better. Maybe your brother, sister, cousin, whoever it is, does something better. Let them do it. Your progress is your progress. Use your own metrics. Don't use them as metrics. Now, we do have a tendency to compare our biggest weaknesses with other people's biggest strengths. And this is unfair. It's usually not accurately anyhow, right? That we look, oh, wow, let's say somebody, they make $2 million a year and you don't make anywhere near that. And you're like, wow, well, they're a millionaire and I'm not. Well, but maybe they put more time and effort in. Maybe there's something related to that. Maybe it's how they make the money or how they go about that. And it's looking at that. Don't say, oh, well, because they make 2 million, I'll never make that. You don't know that. But that can be your depression talking. It's encouraging that hopelessness, helplessness, and worthlessness. And you want to resist that. Now, the next one are positive experiences. You want to schedule positive experiences. Don't wait to be in the mood, right? You want to give your permission for a 30-minute vacation or schedule a healthy hobby every day. Something to do, something that you enjoy. It can be singing in the car, right? Sometimes you got a favorite song or something, you like singing that in the car. It's something that's a vacation. It's something positive for you. It could be just staring at the wall. It could be watching a sci-fi show. It could be whatever you want, but build in that vacation every day to give yourself a break. You have to have those positive experiences. Doesn't mean you're lazy. Now that's your depression talking. That doesn't mean you're lazy. It means you're giving yourself a break. Okay? You want to practice gratitude. You want to take time to notice what went well today, not just what went wrong. That's your depression talking. Your depression wants you to see everything in the negative, wants you to see all the struggles and problems and failures you had, but also focus on what went well today. Consider keeping a gratitude journal, right? Be grateful for the blessings, right? That doesn't mean that you're blind to your problems. It means that you're not buried under them without seeing the light ahead. Now, the next one is be present focused, and that's practicing mindfulness. I do that with a lot of my clients, and we practice mindfulness. It's not meditation. It's being centered and focused on the moment. You are mindful of the present, of what's going on around you, how you feel, how you think, and all these other factors. Sometimes you can do it with a cup of coffee. So being mindful of a cup of coffee can be, do you have the coffee and you smell it? And is it rich, right? Is it a very, is it a strong aroma? I like cream and sugar in my coffee. You know what I mean? So if you smell it, can you smell the cream? Can you smell the sugar? We use this, it's called the picnic creamer. It's a really nice creamer. But you put that in there, you smell it. You get a whiff for that. But that's mindfulness. It's being present. It's closing your eyes, just smelling it. Also holding the mug, if it's in a mug or if it's in a cup. So, I wake up really early. So if I go by Starbucks and, so it's usually pretty early. So it's super hot. So I have them double cup it, but I'll hold the cup sometimes and just kind of take a second and think about how it feels in my hand, how the paper feels in my hand. Does it have that little, what is that thing? That little temperature, so it's not as hot, right? That little band that they put on it, you know what I mean? And so it's that, but that's mindfulness. It keeps you in the present. It doesn't have to take up hours of your day or even more than a minute, but it's being mindful. It's giving yourself that moment, that break. The next tip and strategy is focus on people who lift you up. Now, birds of a feather flock together, so you have to be careful because you may notice that folks around you may have a tendency to be negative, right? Well, try to resist those negative Nellies as much as you can. And, remember that try to focus on the positive. Try to focus on people that encourage you to do well, that encourage you to challenge yourself, to grow, develop, try new things, right? Just because you try something new doesn't mean you're going to succeed, but it doesn't mean you're going to fail either. And learning from those experiences help bring you forward. Okay. And then for the last one, it can try to keep a regular sleep schedule. This is a tough one. I can tell you that my specialty area is personality disorders. And a lot of my clients, if their sleep is dysregulated, they have a really hard time managing what are called their maladaptive patterns. And those maladaptive patterns are these very, destructive beliefs, behaviors, and patterns that they tend to engage in. So when we're learning new adaptive strategies, which this whole channel is based on building adaptive strategies and optimism and positivity, but when you're tired, it's hard to do that, right? So then what happens is you go to these default maladaptive patterns, drinking, drugging, promiscuity, acting out, whatever it may be. So trying to maintain that sleep schedule is so important, and getting the sleep that you need is so important. Now, we live in a world that is sleep deprived, and that directly relates to depression. Is that there is a strong correlation between insomnia, depression, sleep irregularity, depression. So managing that sleep is so, so important. And, having a ritual or a routine before you go to bed, winding down, things like that, not watching TV, not watching the news. Don't do that. I like to watch something funny at least 30 minutes before I'm going to go to bed. Okay. I also have some resources that can help you. It's a national helpline as well as National Suicide Prevention Lifeline. Also, there's a therapy route, which are helplines for suicide hotlines and crisis lines around the world. So those will be in the comments section, so you can check it out. And I hope you found this video helpful. Thank you for your time and attention. And please like, share, and subscribe. And check out my other channel too. Come on, why not? Thank you very much. Take care, and bye-bye.